Okay, here we are again, traveling on the road. This is my second outing since having the surgery. It is day 16, I believe. 16 days since the surgery was done. I'm on my way to Las Cruces. It's about 250 miles from where I live. And Tuesday I'll have a follow-up with my surgeon. He'll look at my scars, hopefully take some x-rays, and just sort of check on my progress. So I'll see him at Las Cruces Orthopedic, and then Dr. Williams with Agape Pain Management, just to let them know how I'm doing and what's going on. And each day is better than the last. I feel much better right now on the road than I did the other day, so that's good. I'm on a lower dose of meds and still I'm able to sit here, and I feel pretty good about it. So since we're going to Cruces, I'm hoping to come back with 20 or 40 pounds of Hatch green chili. It's what we wait for every year. Best chili ever, anywhere. So I hope y'all are doing well and enjoying your Labor Day weekend. Appreciate your family and love on them, and spend time with them if you can. Family time seems like we don't have enough. And I'm looking forward to seeing Abigail and Sophia and my daughter Sarah and son-in-law Steve for a couple of days. So that'll be nice. And thank you all for your continued prayers. I sincerely appreciate your continued prayers. That's what got me through this whole ordeal. And I'm so grateful to have gone through with the operation. And I know a couple people who need the same operation. One of them just won't do it because she said she doesn't want the scars and she doesn't want to go through it. And that is just silly, because when you have chronic pain every day in your life, you don't really have a life. You stay at home a lot. If you can have a job, you're taking double doses of Percocet or hydrocodone just to get through your shift, and you're making it harder and worse on your body. These back procedures that they do now, the Spinal Fusion, is the second most popular surgery done in the United States. So it's pretty much routine, and these doctors know what they're doing. And if you have back pain, if you have an injury, if your doctor says you may need surgery, please just go do it, get it done. Yes, for 2 weeks you have to go through hell to recover from it, but remember, it's only temporary. It does get easier, it does get better. So I want to urge you, if you're putting it off, please don't. Please read up on it, Google it, look on YouTube, find out about it. I think the more you know about it and how the fusion's done, how your body heals, I think the more you know about it, the less afraid you'll be to have it done. Some people have to have knee surgery or elbow surgery or whatever it is. I suggest you do it now while you're young. Even if you're 50, that's still young. And don't wait till you're 75 or something, because the risks of pneumonia and infection are higher if you're older. But that said, the research that I did, I found out that your risk of pneumonia or infection after this surgery, if you're a good healthy age, is only 1%. So that's telling you right there you're probably not going to get an infection. You're probably not going to get pneumonia. So eat good, take your vitamins, see your doctor, and follow through with what they're telling you, and get a second opinion. If you're not sure, find another doctor if you're not sure. But your body can't heal itself in these circumstances. And what the doctors do, really, they're fixing the problem, but really, your body's doing all the work. It's like you have a broken bone. When you get the spine surgery, it's a fracture. Your body treats it as a fracture, and when it's put back together, it can start regenerating, rebuilding that bone tissue in that area. So the doctors are really just putting your bones in place so that your body can do the rest of the healing. And yeah, it takes a long time. It takes 3 months to where you can drive again and go back to work if you have a desk job. And it takes 6 months if you work hard labor or working in the oil field, like around here, doing a lot of hard outside work. That'll take 6 months, and then in a year you'll be completely healed. And really, wouldn't you rather be spending that year healing instead of staying broken and staying indoors and not having a life? So I hope that you would consider getting it done. My story is that it worked out well, really well, and I'm healing and I'm getting better, and I wish I'd done this 10 years ago. You might have to jump through some insurance hoops. Some insurance companies want you to go through the physical therapy and go through the steroid shots and RFA, nerve numbing injections. Just go ahead and do it and get started, get it done and out of the way. And I hope that you would consider doing it and just do it and be healthy and get your life back on track, because I feel brand new. I feel I'm hopeful now, because when you're down and out, you do start to lose hope. No matter how strong your faith is, it's still very discouraging.